My name is Cassandra Pierre. I am a doctor, an infectious disease doctor at Boston Medical Center and a professor at Boston University School of Medicine.
I'm Laura White. I'm a professor of biostatistics at Boston University.
What is your job? What projects do you work on for it?
I have a few jobs. I work in a clinic taking care of people living with HIV, including pregnant people living with HIV. I also am a hospital epidemiologist, which means that I look for, track, and prevent infections that could be circulating through the hospital so that we can protect our patients, keep them safe.
I work with other epidemiologists. So really diverse teams trying to answer important public health questions. So we try and understand things like how are diseases spreading in the population, COVID right now, how much is it spreading? Is it getting better or worse? And what kind of data we need to understand that.
What is your favorite part of the job or something that keeps you motivated?
Connecting with patients and the people who are most affected by diseases and getting their help and figuring out what the solutions to protect them would be. So, for example, one of the projects I did was working on an injectable medication, antiretroviral, to treat HIV. When it came out on the market, it was really a game changer because we didn't have an injectable before. And the nice thing about this injectable is that you can give it once every 2 months and it replaces all of the medications you would have to take with HIV, which is amazing. And we thought, wouldn't this be a great thing to administer to people who don't have steady or stable housing? Could we do this? And we got their input. We said, is this something that would work for you?
I come from a math and statistics background, and I really love that I have these exciting ways to bring that skill set to problems that really directly relate to human health and immediate needs in our society that I think a lot of people can connect with. It's just really fun that I get to kind of use that part of my brain, that training that I got, and think about how does it really apply in problems that impact people's day-to-day lives and help our communities be healthier.
I will attest that the hottest commodity in a hospital academic setting is a statistician. We're all trying to get to Laura. Help us.
It's, not many people like it, unfortunately. So I hope things like this help people realize there's a great need for statisticians. If you have any inkling towards math, it's just a lot of opportunity. It's a really great field to be in.